Hello, everybody, and welcome to today's webinar. I'll be your host today. My name is Cliff Levine, and I am the Senior Vice President of Business Development here at Kipu. I've been working with Kipu since 2013 and have helped over 500 organizations meet their objectives with the implementation of Kipu. At Kipu, we believe that technology is the lever that can help us to improve efficiencies, treatment quality, patient and financial outcomes. And we're really honored to play a small role as part of the solution when it comes to addiction treatment and behavioral health. Our goal for these webinar sessions is to simply share what we've learned from some of our most influential clients throughout the country and to provide you with information that can help improve efficiencies within your programs. Today, we're honored to have Michael DiMarco. He's the Director of Business Development for the Crossroads Companies. He's going to be sharing insight today on why they made the transition to Kipu and talk about some of the benefits they've seen from using the platform across all facets of their company. And one of the overarching topics today is, how the Crossroads Companies has been able to continue to grow their organization despite the pandemic. And I think it's a really interesting utilization of technology and how technology has helped organizations to overcome a lot of the challenges that have come along with, everything that COVID-19 brings along with it. We'll go ahead and move along here. And so for those of you that are joining today that might not be familiar with Kipu, we offer a platform that can help organizations to manage their medical records. And so our core platform is our electronic health records solution, which is our flagship product. We currently have over 1,600 facilities across the United States to use the platform, and that amounts to about 80,000 daily users. Recently, we've actually celebrated our millionth episode of care that has gone through our system. And so it is a battle-tested, proven product in the space. One of the hallmarks of the EMR solution is its ease of use. And we can handle the entire episode of care from a phone call coming in to admitting a patient. From a clinical perspective, we handle all the treatment planning, therapeutic group notes, documentation. Additionally, we can track outcome measures for organizations that want to have a better way to track and manage patient outcomes. In addition to the EMR product, we also have a CRM platform, which we'll talk quite a bit about today. The Kipu CRM is a platform that integrates seamlessly with the electronic health record and allows organizations to track and manage their marketing campaigns and initiatives. It allows organizations to have better tracking of the referrals they're receiving from other organizations. For facilities that accept private insurance, there's a lot of tools within our CRM platform that are really helpful in tracking and managing the verification of benefits process. We also have within the CRM a number of different integrations for organizations that allow them to have a much better way to get all of the information they need in one place. And so our CRM does feature integrations with call tracking platforms such as call tracking metrics and call rails and many others. We can also bring in email communication into the records within the CRM. And so folks that are using email services such as Gmail or the G Suite, as well as Office 365 and an Outlook email, we can integrate and bring those emails right into the system. We can integrate with your mass email marketing platforms such as Constant Contact or MailChimp. And we work with our organizations that use the CRM to make sure that we integrate all of the various tools that they use as part of tracking their marketing and admissions processes right into the platform. Additionally, for our organizations, we of course have to have a solution to manage their billing process. For organizations that are submitting claims to various payers, whether you accept Medicaid or commercial insurance, we have a platform that can track all of your billable services, provide the appropriate coding for those services, generate claims, whether they be institutional or professional claims. And through our integrated clearinghouse, those claims can be sent directly to the clearinghouse. And then we actually have a full cycle revenue cycle management platform that allows you to then track claims that have been sent post payments, manage denials. It's a full stack revenue cycle management platform. And just a couple other points regarding the integrated billing platform. One of the things that I think is most impressive is how we can automate the tracking of the services that are being delivered, and that's driven based on the clinical documentation that's being entered into the EMR, which is really helpful for organizations that may have a manual billing census process that they run through at the end of each week, and then they pass it to their biller, and then their biller has to create claims one by one. That can take hours and hours, whereas our system at the end of each week, if you're utilizing our integrated billing platform, it can provide you a list with every single service, how many units, for attendance-based levels of care like partial hospitalization or intensive outpatient. We can even track how many programming hours each patient has received and notify the biller if the patient did not meet the proper amount of programming hours that are needed in order for you to bill for that level of care. So the automation that comes along with our integrated billing platform offers huge efficiencies to organizations that might have a very manual way of tracking and coding services and getting those claims out. And of course, if there's any interest on any of the platforms I just described, I'd be happy to provide a demonstration to anyone interested, and you'll see our contact information at the end of the presentation. I'm pleased to introduce our special guest, Michael DiMarco. He is the Director of Business Development of the Crossroads Companies. They currently utilize our entire enterprise platform, which of course includes our CRM, our EMR, and our integrated billing platform. Thanks again, Michael, for joining us. And I would like to just start us off here by having you tell us a little bit about yourself and also talk to us about the history of the Crossroads Companies.
All right. Thank you, Cliff. You can hear me?
I can hear you loud and clear. You sound great.
Perfect, perfect. Well, welcome those of you that are dealing with the impending storm here in the Northeast. My name is Michael DiMarco. I'm the Director of Business Development with Pro Recovery Solutions, also known as the Crossroads Companies. I'm from the Northeast. We're a Northeast agency. Actually went to school at Rutgers University up in New Brunswick, and I have a degree in economics and finance. I don't want to age myself, but we've been using CRM products in banking and finance and the registered investment advisory field that I was working in for a long time. And with relationship management, some 14 years ago, I had the opportunity to work with a very small agency at the time, Medicaid shop called Behavioral Crossroads, that was basically a mental health partial care program. We have had the opportunity to grow and expand in that last 14 years. I wanted to talk to you about our agency and how we use the CRM and the EMR. On this particular slide, my email address, my cell phone number for anybody who wants to ask any questions or follow up with me later, feel free. So I started with Crossroads about 14 years ago. And again, at the time, we were a Medicaid primary mental health partial care program that I always tell this story because it's so interesting. I mean, we had 60 clients on the census. We saw 40 clients a day. And here we are in 2020 with about 5 locations, 550 some odd clients on the census. And we're working with not only Medicaid, but in-network commercial insurances, governmental contracts, publicly funded individuals, as well as our high-end demographic dealing with, private pay or out-of-network benefits. The agency has grown, and what I'm very, very proud of is for an individual based out of Southern New Jersey, we really can work with most individuals. We cross so many different demographics Our agencies are licensed as mental health primary, substance abuse primary, with co-occurring services. We run very large patient centers in Egg Harbor Township, and some boutique agencies, Green Branch Wellness and Recovery in Egg Harbor Township, which works with professionals and paraprofessionals in Egg Harbor Township, and then in the Gloucester County, Camden County area, Recovery at the Crossroads, which is a very high-end boutique trauma-informed care center that partners with an affiliated sober living campus. And we offer a very high-end trauma-informed care with EMDR for individuals that need an extended stay. All that being said, it's so much easier to manage our BI and our EMR with a combined package. And working with Kipu, we're doing that on all levels, which has been a pleasure. I think we've been using the EMR with you, Cliff. Help me, I want to say 3, maybe 4 years we've been EMR, and very strong now using the CRM now for about a year.
Yeah, I do remember fondly actually visiting with Shlomo years ago. I think I met you guys back in 2014 or 2015, and I think shortly thereafter you guys started using the EMR, and more recently here you guys have adopted the CRM platform as well as integrated billing, and so we've been working with you guys for quite some time, and it's been amazing to watch you guys grow and expand and continue to offer more services to wide demographics. And so that's something that I admire about the Crossroads is you have programming for everybody, and I think that makes you unique. As you see a lot of programs that maybe offer private insurance or commercial group insurance or just Medicaid, and you guys kind of have a myriad of services to be able to meet the needs of all the patients that might need your services.
Yeah, for sure.
And so I'm going to go ahead and we have some questions set up for you today, Michael,
Okay.
just to talk on a variety of different topics that I think the audience would be really interested in hearing your experience, in a number of different areas. And so the first question that I have for you, given I know probably everybody is sick of hearing about COVID-19 by now, and hopefully, I've been seeing these videos of the first individuals getting vaccinated recently, and so it finally seems for the first time like we're starting to see the light at the end of the tunnel, but there's obviously a long way to go here before we return to normalcy. And so my question is, how has COVID-19 affected you in 2020? And what are some of the challenges that it's brought to your operations? And what are you guys feeling in terms of what it's going to look like going into 2021?
Well, I guess in March, I want to say March 20th or March 21st, we kind of experienced the full weight of COVID here in New Jersey. I see we have about 19, 20 people on the call. I'm really not sure where they're coming from in the nation, but it almost felt like we were ground zero. And one of our boutique agencies, our premier treatment center with the sober living component, Recovery at the Crossroads, it never slowed down. It never stopped. And so from a COVID standpoint, we immediately embraced the CDC protocols. We already had Zoom as part of some of the software packages we were working with. And in that particular agency, we embraced it. We took everyone's temperature as they walked in the door, monitored our social distancing, opportunity based on the regulations at the time to keep going. The agency never really slowed down and had the opportunity to grow. Our proprietary lab, which we embrace on a daily basis, gives us both the opportunity to have antibody testing and COVID testing for staff and clients alike. So we, once we eliminated the initial panic and we understood where we were and clients and had the ability to test, it was just a lot easier to move forward and deal with the new reality. I mean, everybody on this call understands how fluid the last 10 months. I mean, it's funny, we would talk about what was going on, today, this week, this month, and things were changing by the minute. Everything was just so fluid, and the policy changes on a governmental level were so fluid. It was nice to be able to embrace your operating system, your software, because it put us in a situation where we could work remotely if we needed to. We cater to multiple demographics and multiple funding sources, so we have different kinds of agencies that we're dealing with different individuals in need. And, the problem with COVID initially was quarantines and layoffs and social isolation, which really embraced the need for mental health and substance abuse treatment. But if you're being laid off, you're losing your insurance. And so the high-end demographic programs get challenged. The in-network programs, they do well. And then your welfare population and your publicly funded programs can do well, but not if you're social isolating and not if you can't reach out to your clients. So, we were very agile in offering Zoom technology, in-person meetings, when relevant. Obviously, in a substance abuse primary world, we're really worried about urine drug screens and making sure that our clients are safe. So we always had to have a degree of connection with our clients. As I said, recovery at the Crossroads never really closed. We took maybe a 2-week hiatus and used Zoom for what we call Green Branch Wellness and Recovery in Egg Harbor Township, our professional and paraprofessional program, which went to straight Zoom technologies. And then our Behavioral Crossroads Recovery program did a wonderful job. And I have to compliment the clinical staff, the counselors, the transportation department, because they absolutely did everything in their power to run a quality program with evidence-based activities to do outreach and see our clients, and keep the doors open, socially distant, to make sure that people can get in, get their urine tests, have the opportunity for COVID testing, and still get on with their programming.
Yeah, there's a lot of changes that programs have had to grapple with, as you mentioned, and definitely the adoption of new technologies to be able to provide care to those that may not be able to come to a brick and mortar office as they typically would with the pandemic. And yeah, as you mentioned, utilizing Zoom to be able to provide telehealth sessions. And we've recently, within the Kipu EMR platform, we now have a native Zoom integration just to make that technology hurdle for clinicians or medical staff that may be providing sessions via telehealth easier, because that was one of the things that we saw when this pandemic came along. Everybody very quickly needed to learn how to utilize new tools to be able to keep their operations going. And so with our Zoom integration built right into the platform, it's included with Kipu. We don't charge extra for it. It's something that's included. And so some of our clients are getting savings in terms of all the Zoom licenses that they had to manage standalone. But I think the most important aspect of that tool that we've integrated is the ease of use of it, because you have clinicians of all different levels of technical proficiency. And so it's built right into their calendar within our EMR. They create a telehealth group or individual session. And all they have to do to actually start the session is just go back to their calendar appointment and click start session, and it opens Zoom right up. They don't have to fumble around with usernames and passwords. And for the patients, they receive a meeting invite right off of the calendar. And so I think that's been a really nice enhancement that's made it easier for our customers to be able to deliver those types of services. But it is interesting hearing your insight on how it's impacted you in various ways. And, like you said, with social isolation and some of the impacts that it's had, to mental health in the United States, we saw across the company, we have, 1,600 plus facilities operating on Kipu. We actually saw an increase in the overall census across our customer base, which was a little bit unexpected, frankly. And so it's great that you guys have been able to continue to provide services to those that are in need, despite the challenges that came along with the pandemic. And so, moving into our next question, what is your outlook in terms of the landscape for addiction treatment in 2021? As we hopefully begin to get more back into, I guess we can call it our new normal. But what are your expectations and your outlook going into the future here in 2021 and beyond?
Well, Cliff, I want to thank you and Kipu because of the ability to work with your software. We're really optimistic going into. You just mentioned that you saw your census of users increase. Our high-end demographic programs, Recovery at the Crossroads and Green Branch Wellness and Recovery, have very healthy census. They're basically where they were in the beginning of 2020, in that January, February period before COVID. But the hidden gem, the hidden blessing, our Behavioral Crossroads Recovery Program, because of Zoom technologies and because of using the region, not necessarily the territory, we found that a census of 155 to 160 10 months ago actually sits closer to 305 today.
Wow.
We exploded in size, and a lot of it has to do with the integration of these software tools, the ability to deal with our campaigns, our communication, our ability to reach out to the clients clinically on a platform like yours where it's cloud-based. Even today, I hear the rain on the roof, so it's not snowing here in Egg Harbor Township in the Atlantic City suburbs, but I hear there's already like 2 to 3 inches of snow potentially hitting Toms River and parts of Philadelphia right now.
Wow.
With Kipu, it doesn't make a difference where we work. We're remote by nature as long as the hardware is ready. So yeah, we're looking really optimistically at 2021. The vaccines are out. Yes, it might take a little bit longer. We're working with different populations that are still isolated by the government. Medicaid is really shut down to some degree on a mental health side of things. And so we are invested, embedded, and ready to work. And we have some significant outreach tools. Our van drivers have a food grant program that we already had based on the Food and Drug Administration with our mental health Medicaid population and our Medicaid substance abuse population in the programs called Behavioral Crossroads. Those individuals are getting 5-day food boxes delivered to them by our van drivers. We're still keeping our transportation fleet employed. Although our clinicians aren't out in the field touching our clients, they're talking to them on the telephones, they're going into telehealth sessions with them. And I know you lose part of that therapeutic relationship with telehealth, but we still have the blessing of having our van drivers out in the field, visiting clients, taking cues and reads, and dropping off well-needed supplies and food in this crisis, in this pandemic. So I think the supports are in place. I think the technology is in place. I think the vaccine is here. We just have to stay healthy, stay safe, stay distant, keep our masks on. And I think we're going to have a promising 2021 as long as we dot our I's and cross our T's.
I totally agree, and I'm sure everyone can't wait to put 2020 behind us, and so I think everybody is optimistically looking towards 2021. And the silver lining to this whole pandemic is that it has actually forced a lot of organizations to maybe utilize technologies that they wouldn't have used had this not have happened. And so I know the loosening of the restrictions in terms of, telehealth and it being reimbursed. My hope is that, the country has seen how effective telehealth can be and how much more access to treatment we're able to provide through telehealth. And so, most of the clients I talk to, they all say that even when this pandemic is behind us, that they're still going to continue to provide telehealth services, and they feel it's a core aspect of their program that they're able to provide. And so that's been nice to see that, that's maybe one of the fortunate byproducts of, this very unfortunate situation.
Right. Yeah.
And so
Agreed.
my next question, Michael, and we talked a little bit about this earlier, is, maybe you can tell us just a little bit about what makes your facility different from, a lot of the other facilities out there.
Well, I'm really proud of who we are, what we are. Again, as I had mentioned 14 years ago, we grew out of Medicaid. We have 2 high-end programs that are dealing with clients that are either out of network or private pay. We kind of work towards a $500-600 a day rate, maybe a $15,000 a month for a combined extended stay, trauma-informed care, substance abuse as a primary curriculum with a sober living. Having that kind of a broad base makes us so different. If somebody lives in Southern New Jersey, there's a really strong possibility that we can help them no matter what. Our demographic balance caters to all residents in our region, and it really doesn't cater to individuals that are just affluent. We can work with everyone. Sure, we'd love to work with high net worth individuals and have huge profit, but we also are realists. We're helping everybody. I can sleep at night knowing that our team does as much as we can every single day for citizens of Southern New Jersey, and it makes it a great place to work. I've been here 14 years. I'll be here 14 more. I'm not really in a rush to go anywhere right now.
That's great, and I had that feeling when I met with Shlomo years ago, and it was just great to see how passionate everybody is within your organization, and the drive to help people and meet them where they're at. And there's programs, but there's not many out there that basically, regardless of what that individual situation is, you guys have a program that can support them in some form or fashion, regardless of what insurance or Medicaid they have. And I think that, again, is admirable that you guys are able to provide such a wide range of services so that you can help everybody. And so that brings us to our next question. And so you mentioned you've been at the Crossroads Companies for 14 years, and when it comes to technology, that's like a century, right? Because technology changes so quickly. And so the next question is, how has the technology changed how you're delivering care today?
Well, I've always worked with CRMs from a marketing perspective, whether it was financial sales, brokerage, or healthcare. I mean, I took my first CRM, brought it to the Crossroads Companies, massaged it, manipulated it so I could have a relevant database based on the relationship marketing that we were doing. At the time, it was from a clinical standpoint, all clinicians used, white paper, black ink, manila folders, had to be locking. And we've had the ability to embrace with the EMR through Kipu now for what did we say, 3-4 years, and now we have a whole entire integrated platform. It really balances out how we do things, and it's been one of our greatest assets. We can talk about, well, maybe right now, I want to say 14 months ago, we started with a CRM. We were able to integrate the phones into the CRM, manage the schedule, get clients into treatment. The clinicians got on board with the EMR. And now with this digital platform, we can do everything. And as long as it's cloud-based and as long as you have the appropriate hardware and software, environmentally speaking, whether it's a snowstorm or COVID, we don't have to stop doing what we're doing. We're able to keep going and deliver the same highly efficient care because the technology is much more stable, cloud-based, and we're not necessarily linked to brick and mortar, like you had mentioned before.
Yeah, those are all great points, and it's interesting to see with the technology that's available today that people can pretty much continue to run their operations as they would even if they can't get to their office, and it's pretty neat to be able to see that despite being in a lockdown, you guys can still provide the same level of services to your patients, because the technology is there to help drive that.
Right.
So my next question, Michael, is going to be, what measurable results have you experienced as a result of specific platform features like the call queue, Kipu's call tracking integration, our email integration, as well as the patient pipeline that's available within Kipu's CRM?
Well, like I said, 14 months ago, we were trying to plan for remote access during snowstorms. We needed to make sure we had the right hardware. So we got out of terminal servers, which are virtual port replicators, not computers, and made sure that all staff had laptops in my department, because we started using soft phone technologies. We were using the call queue with call tracking for targeted marketing purposes. We integrate with, I think you had mentioned, email integration, and we use Outlook 365 if anybody does. I guess while you're showing us the call queue, in the call queue, we kind of can work with the comm log. We're dealing with the last communication for that particular client. We're setting up the disposition. This is where a client comes in. It's an effective, it's a real client that needs to be treated from the phone line. We pull the information directly into the database, set up the opportunity, close out the disposition, and we can create the client and pull them into the pipeline. The information on that particular campaign is involved in the phone line. We know, whether it's some kind of programmatic ad, a billboard, some kind of magazine ad, any kind of situation based on the campaign piece. We can, in our agency, I guess what's interesting is we have 4 programs. So our call queue can be broken down based on programs. I guess I'm talking about the pipeline. You're in the pipeline now.
Yep.
So yeah, I can select all, or I can break it down by the individual programs, and we can look at some really key features. We want to know how long the particular individual's been in the pipeline. We want to know what the opportunity status is in the pipeline. Opportunity for us is pretty important because for us, that's a way for us to gauge how we can close and convert. So, are we gathering information all the way to, is the client scheduled and admitted? It's the first time we've actually had the opportunity where the CRM on one side and the EMR on the other can actually work together. If we schedule a client in the pipeline and they're admitted in the EMR, they come off the pipeline. If they're discharged in the EMR, they come back into the pipeline as an opportunity for us to work with them. So it's a great place to keep us organized. It's a great place to keep us structured. It's a timestamp and it's a ticking clock. So we want to, not lose an opportunity, close on an opportunity, and let us know how time sensitive it is to get them into treatment, into care. It's been a really great opportunity to work with the complete system in one software solution from end to end.
Yeah, that's one of the things that we hear most often, and it's something, frankly, that I've seen, since I started here at Kipu in 2013. Back then, a lot of facilities had so many different software platforms. They had a CRM, they had a different billing software, maybe they had an EMR, they were on paper. And so they had all these different software tools that none of them spoke to one another. And that is challenging because, as you mentioned, right, when a patient is discharged at the facility, the business development and the alumni team has to get re-involved with that individual on their way out of treatment and start post-discharge communications with that individual. And so when you have multiple systems that aren't talking to each other, now you're looking at emails going back and forth, comparing reports and spreadsheets. We call it an Excel gymnastics. And so when you have a full enterprise platform with all of our tools talking to one another, passing the appropriate data where it needs to go, it makes it a lot easier for you to have that one source of truth. And that's something that I think we provide. And again, because we're specialized for addiction treatment and behavioral health, it's not like a traditional CRM that you have to customize around your business model. It's really built based on our experience and our shared collective of customers' experience, which gets people to a really high level of sophistication in terms of the way that they utilize the tool much more quickly than it would be had they had to build something out on their own.
Right.
So I know you mentioned that you guys are just starting to get your feet wet in terms of utilizing Kipu's business intelligence, which is one of the newer features that Kipu offers. And so I'd be curious to just know a little bit about how you might use Kipu BI now, and some of the potential that you see in it moving into the future in terms of what that feature set provides.
I mean, it really helps us with key performance indicators. I think I alluded to in the prior question how we're using it. I mean, the BI is being collected based on the particular campaign activity. Whether we're using a specific tagged phone line that's supporting an SEO campaign, a programmatic campaign, a billboard that's out in the street. Sometimes it's a magazine ad or a traditional newspaper ad. Sometimes it's just websites or social media campaigns. And that information correlates to a scheduled intake. It converts into a client that is admitted, and it's real-time data that we can actually put a cost analysis to that shows us where the return on our investment is. And the beauty of working with the admission and the discharge and the CRM, we can go in and see how many clients came through a particular marketing campaign, how many calls we really had, how many clients were converted, and how many made it actually into treatment. It's definitely one of the dashboards that is working very, very hard to give us everything we need to know where we stand, know how dollars are spent, and to understand that ROI, the return on that investment. We're eagerly looking forward to using it. We're coming to a point where we've maybe got our first quarter's worth of information in there. And next time we have this conversation, for sure we'll be able to talk about the real data. Yeah, we're starting to use it now.
No, that's exciting, Michael. And what we wanted to introduce reporting capabilities and data visualization, because what we were seeing was a lot of organizations were relying on Excel spreadsheets and pivot tables maybe they even went out on their own and got their own business intelligence platform and were extracting the information from the various systems they used and had to have a database analyst within their organization to be able to produce reports like the ones that you guys see on screen. And so when we introduced this, we really feel that data is extremely powerful, and if you are able to harness the power of the data and it's able to be presented in a way that allows organizations to gain new insights into which aspects of their operations are running well, maybe where it's not running so well, the data can tell a story. And so for us, data and how we can take the data that's within our platforms and present it to our customers to help them to be able to meet their organized objectives is one of the most important things that we're doing now. And so there's a huge focus on Kipu's side of things, on being able to harness the power of that data, from clinical data and using it to be able to help the clinical teams and medical teams analyze the outcomes. They can look into the data and see which treatments are the most effective, what is their AMA rates, what does the clinical performance look like by therapists on screen. This is one of the reports that I hear from a lot of our clients they really appreciate, where it's showing month after month referral tracking from their various partners for these business-to-business referrals for facilities that receive a lot of referrals and want to be able to see, how many referrals did we get from ABC Recovery last month? How many did they try to send us, and how many ended up admitted, right? And so basically you're seeing the attempted referrals from an organization, the total number of admissions, and the percentage of conversion of those referrals that were made. And so again, we build these dashboards from our clients' feedback, and it takes the weight off of our clients from having to build these things in-house, because we don't want you guys to be sitting there building Excel spreadsheets. That's our job. We want you to be able to log in and have the data you need accessible and ready to go without having to massage it. And that's where I think BI really is a competitive differentiator for us, which is really a critical. And so let me just move to, and our last question here, Michael, and again, appreciate all the time you've spent with us thus far. I know I've worked with you personally. I know many of our members of our team have worked with you in terms of supporting the Crossroads companies over the years. And so my question would be, can you tell us a little bit about what your experience has been like, with Kipu's implementation team, our client success team, and just general support experience?
Sure. Like I had said in prior conversations with you and your team, when we work with your CRM team, we work directly with Jason Bedoya, or EMR, we work with Jack Montero. I personally feel like they're the guys down the hall. They're always available, whether it's by cell phone, by email, or through a real quick WebEx chat. We get almost immediate and definitely within the hour contact, special tasks, adhering to special features when we want a certain kind of report. I kind of feel like you guys are on our staff. There's never an opportunity to criticize, because literally it's like taking that 5-foot walk and knocking on the door 3 doors down, and there they are. Never really have a problem. Your guys are on point. Having you up here, we've probably had you guys on site 2-3 times in the last 2 years. And with the video audio technology, just like we're talking now, you're in Florida and I'm in New Jersey. We're 1,000 miles apart, but we're talking and we're getting things done. Never an issue. You guys, as long as we have the right hardware, you guys seem to have the right software, so it's working out.
That's great. No, I appreciate that, and being hands-on is critical for sure. And Kipu does provide 24/7 client services, and it's unlimited. I think the unlimited aspect of it is a really important point for us to just let those on the call know. There's never a point in which Kipu will say, you know, we've gone over budget on the amount of hours that we've spent with you, or we don't ever charge for customization. And so as organizations grow, their needs change. They have more programs they're opening, more levels of care that they need to support. And there's always work that needs to be done to continue to grow with our clients. And I just think it's super important for, you know, for our customers to know that whenever they need something, all they have to do is ask, and we're not going to, you know, attach an invoice for extra support. And that's critical, because I know a lot of the different, you know, services out there may have limits to how much service you can get. And, you know, with Kipu, it's unlimited. And so, again, really appreciate Michael. I'm just going to wrap us up here talking about a quick study that we performed related to the CRM. You know, on screen, you can see a recent study we completed. It was a 9-month study on the Kipu CRM that demonstrated an increase in admissions by an average of 22% and as high as 40% in customers that made the transition to Kipu CRM, and that was over a 6-month period. The way that we did the study is we basically performed, we tracked the number of average daily admissions across a sample size of 174 customers before and after the implementation of the Kipu CRM alongside Kipu EMR. We first took a look at the average admissions in the 3-month period prior to customers making the transition to Kipu CRM. And on average, the facilities covered in the study had about 71.2 admissions during this 3-month period. We also found that admissions were rising slightly during this period, and we attribute that to a new attention to best practices during the implementation of our CRM platform. And so we allowed a 3-month shakeout period once they started using the CRM. And, you know, we were able to find that within 3 months, organizations were able to increase the rate of admissions by 22% on average. And so it's a really interesting study. It's available at our website. Anybody can email me after the presentation. I'd be happy to share it with you. But really, you could see in the visual on screen here the rate of admissions, and we then see a 3-month go live and training while folks are getting used to the system. And then after that 3-month period, you could see the rate of increase in an organization's admissions are increased after it. And we think partly due to the platform, of course, and also because when you have a CRM implemented, it's going to increase accountability of your business development and admissions teams, and just having that overall new attention to best practices helps as well. I'd like to give special thanks to Michael DiMarco for spending so much time with us today. I would also like to thank everyone at the Crossroads Company as well. You know, we really enjoyed listening to your insight on, you know, how you've been able to continue to have a positive impact on the lives of those, you know, suffering with substance use disorders and behavioral health issues. I'd also like to thank everybody who took the time out of their day to attend today's session. We hope you all enjoyed it. And I also want to let you all know that if any of you maybe aren't already using Kipu and are interested in learning more about our platforms, you know, we'd be happy to schedule a demonstration at your earliest convenience. And you can see we have some numbers on screen there. You can dial us at 561-349-5901, or you can go to our website and there's a button on the website that says schedule a demo. Click that button, you just give us your email address, and we can get a demonstration on the schedule as early as today. It would be a one-on-one demonstration where you can ask your questions, and we'd love to get to know all of you that maybe are considering looking at different platforms, you know, whether it be our CRM or EMR integrated billing platform. And we also have a special offer. We're offering fast track implementations. We can get customers live in as little as 30 days on the platform. And so you'll also see my cell number if anybody has any questions or just would like to chat with me after today's session. My cell number is 954-881-0394. Please feel free to reach out to me. You can call or text me, and my email address is also there should you have any questions. But again, Michael, thank you so much for joining. and we appreciate everybody that's taken the time today. Thank you so much.
Thanks, Cliff.
Take care.